All right. Next, we have Lo Berry, CEO of Reach Up, a nonprofit whose mission is to help communities achieve equality in healthcare. She recently received a Hero Award by the Tampa Bay Lightning Foundation. Please welcome Lo Berry to the virtual stage.
Good morning. I'm so glad to be here, and thank you all for inviting me to this awesome platform. And thanks to the beautiful sisters that's been on the platform thus far. I guess I would say that because of my age and where I am in life, that I'm probably a show and tell. And so I'm going to sort of do a walking testimony with you all in regards to myself utilizing what I call my keys to the world of maternal child and health. Next slide, please. So what I wanted to share with you very clearly is our mission, our vision, and our motto and our slogan. And the bottom line for us is that we really do believe that families have the inherent abilities to nurture and take care of themselves. And we're simply conduits to that process of changing people's health trajectory and people well-being in life at Reach Up Inc. And I'm very excited about the fact that we have grown very much from our meager beginnings to now. But I must say that it could not have been done without the best staff this side of heaven. And I'm very grateful to the staff and the partners of which I have to run such an awesome organization as Reach Up. Next slide. So one of the first keys is really recognizing your purpose. And this little cute picture are my relatives. And so my oldest grandson standing up in front of the car is Bryson. And he's standing next to his cousins, and his cousins are Asher and Aria, as well as Tam Tam. And I was about their age when I started to show an interest in the health and well-being of Playmate in kindergarten. My mom often used to tell the story of how I had her to make extra food and put in my lunchbox for a kid who had very little to eat. And she would bring her food into a brown paper bag. In the first grade, I noticed that the best reader in the class regularly missed school. And I inquired persistently why he wasn't in school. And I noticed also that in all the events that we had throughout the year, he never once had any representation or anybody to be present for him. And then in the fifth grade, I remember asking permission to my teacher to actually take and walk the homework assignments to a student who was frequently hospitalized and missed school because she had sickle cell anemia. So somehow I always made a beeline to those who I felt was most in need, mentally, physically, emotionally, and spiritually. So I would say that the call on my life started very early. Next slide. So as far as the call on my life, my work trajectory has been very broad, but always staying in the arena of mental health and health. And so I started out this journey as a counselor at a drug abuse program. And then I went into case management at a rehabilitation center and did inpatient detox program coordination work. And then my husband and I opened up our home as a therapeutic foster care home placement, which meant that 2 of the beds in our house was licensed as therapeutic foster beds. And we would work with families and provide respite to families that got children out of the state institution to bring them back in the community to a place of home in their lives. And so my husband and I had our home to be utilized in a way so that the children, what they call blow placements, didn't have to return to the state institution, but they would have an opportunity like 30 to 90 days to get it right or to get reorganized so that we could keep them in that system of care. That's probably been one of the most meaningful career paths that I had in providing those clinical services in my own home. Then I did adult inpatient psychiatric unit at a mental health facility, and also children therapists at the mental health centers. And then I went on in 1998 as principal investigator and project director of Central Hillsborough Healthy Start Project. And then in 2006, we transitioned to our own not-for-profit, Reach Up Incorporated, and we left the university in 2009 to start the community-based organization, which is known now as Reach Up Inc. Next slide. So equipping for the journey. In 1998, I really felt compelled to do something about our Black babies dying at a rate 4.4 times that of our white babies in Hillsborough County. And in particular, in the area where the death rate was much higher, where there was most marginalized people that we were serving and under-resourced. I knew deep down in my heart, though, that there were reasonable explanations for this disparity. And I also knew that where we live, work, play, and worship also influenced maternal health. What I learned, though, over the years with staff and evaluation and research and actual program service is that cumulative stress really impacts the health of women. And in particular, cumulative stress, i.e. the overall health of the woman, racism, and other structural factors really impede birth outcomes. And so our focus continued to be on addressing maternal health before the women actually give birth, and address the health overall, with a special emphasis, of course, on addressing stress. We learned a few things in equipping for the journey, and there's many things that you do to equip for the journey. But the ones that I want to share with you rings more resounding to me now. And one is that I have learned to reject fear. When you're doing this kind of work, it's such a tumultuous work. It's rewarding, but it's up and down and sideways. But I've learned to reject fear of the outcomes, reject fear of the failures, and move forward. I've learned to acquire a team that always have my back, no matter what the circumstances are and no matter what's at hand. The team is always there to support and guide our mission and to make sure we do our best to address the overall health for our families. The third thing I learned to do was to embrace the dream and not to believe that the dream is too big, but the dream that's been placed in one's life and the purpose that one is given should be embraced and not be seen as too big. Being confident with the conquering of any obstacle that's put before you. And the last is I learned to be really deliberate and intentional, not about some of the things that we do, but about everything that we do. In our organization, we eat, breathe, and sleep disparity. And we are constantly what we call on the battlefield to address poor outcomes for all. Next slide. So one of the things that I remind people of often is that whole frame of don't give up, no matter what. And that has to be embedded, I believe, in the psyche. When we started on this journey, you would think that saving babies' lives and getting babies to live beyond their first birthday was an easy task, and that there were little to no politics involved in such. Not so. When we started out the gate, we had those who didn't believe that it should even be a big issue around addressing infant mortality, wasn't aware that infant mortality was a problem here in our community, let alone nationwide. We had people who really rejected the notion that Black women tend to die at 2 to 3 times rate given at childbirth or shortly after. And so in the beginning, there was rejection of the belief and the vision of what our work was about, let alone how we would move forward in this work. And then it went, in my opinion, from rejection to sabotage. People stopped rejecting, but there were folk who intentionally sabotaged the work and put obstacles and barriers in the way so that we could not proceed with the agenda. And then we got to the point where we call it benign neglect. People didn't really reject what we were doing, and they didn't no longer sabotage, but they sort of sat back in what we call sit back in the cut and just sort of watched what we did from a distance. And then we moved into the acceptance phase, wherein people began to see the vision, embrace the vision, and we began to get a lot of support locally, statewide, and nationally around the work of addressing infant mortality and maternal mortality. And that is one of the reasons I really lift up the Don't Give Up. Next slide. So in Don't Giving Up, it takes a lot of support. It takes a whole lot of support. And I can't even say how blessed I've been to have the best staff this side of heaven and a great boss, the board chair of Reach Up Incorporated. And James loves the mission, he loves the organization, he loves the staff, and he loves me. But most important in this type of work, the alignment of our core values and the commitment to the service of what we do and the organization is paramount. And I'm very grateful to that. Next slide. So this slide here that looks a little scary is what we call the visibility and influence. And the bottom line in doing this work, it is critically important to get people to see you, really see you, to feel you, and then want to be involved. And so for us, over the years, we've been fortunate enough to move from our meager beginnings in 1998 with one project, and we have had a combination of more than 14 service projects since our inception. And right now we have 10 social service projects. And our 14 programs have always addressed optimal health, but with a very clear focus around addressing infant mortality, getting babies to come into the world and helping babies to be ushered into the world, with a sense of urgency and with a sense of purpose, and getting them to live beyond their first birthday. And then also addressing maternal mortality and good health, women being healthy prior to giving birth and throughout the course of their lives. So in front of you, you see a listing of all our programs, and I don't want to just state each one, you can see them, but I sort of want to point out a couple of programs and how we advanced in this maternal child health arena. we have always in public health and maternal child health emphasized and put focus on moms and babies. Oftentimes, we've not done so with dads. And for our organization, we started more than 15 years ago, uh, um, stating and creating services and programs around meaningful male inclusion, adding the dads to the mix in the education, the advocacy, and the service delivery. We're very proud of the fact that we as an organization have been able to influence national benchmarks for Federal Healthy Start, where we have two benchmarks, clinical benchmarks that basically says how important it is to have dads involved in the prenatal visits with the mom, as well as his own health visits. And so the last one I want to mention probably would be the one that's getting the most press right now are the doulas. And the doulas are the women who are, our doulas are women who are with the moms during right before birth and delivery, about 4 to 6 weeks, during birth and delivery, and then postpartum afterwards. And then we have additional doulas that can work with the mothers up to 2 years in regards to their mental health status. So we have, as you see before you, a lot of programs that really captures health for our families. Next slide. So we've been around the block a few times. And so we like to share with people what we believe as an organization that sets us apart. And so research and evaluation is critical for us. We're able to tell our story both quantitatively and qualitatively. So we can tell and show what the data says and then what the people say about the work that we do. And what's most important about the research and evaluation component is the fact that it is what helps us to be able to continue to leverage funds and to sustain really important services that we do for the long haul. And then the next is the loyalty. Really fortunate and blessed. My co-founders have been with me since the inception of our program. We've been together for 22 years, Dr. Austin and Vanessa. And then I have an awesome management team that's been with me for 15 years and greater. My right hand, Hope Tackett. If you connect with me or for me or by me, you go through Hope Tackett. And then the diverse staff, and it's diverse with our gender, with our race, with ethnicity, with age, and with discipline. So we're really proud of the fact that we have a diverse staff. Currently, we have about 70 employees. Then is the love of the people that we serve. We serve about 7,000 families a year. Then equity and social justice being embedded in our work in everything that we do. Training and teaching and advocating for equity to be in the forefront of the work so that we can have these great outcomes and better outcomes for everybody and not just some. And then the genuine partnerships. We're really fortunate. Right out the gate in 1998, we established partnership with some of the local churches to be some of our venues and our sites to have meetings and deliver services. But we have a broad-based partnership of more than 40 organizations, and more than 70% of them have been with us since we started. And those organizations help us get the work done in our community. And I mentioned to you about the meaningful male inclusion. And for us, that basically means looking at men and addressing men in this arena in an affirming manner. Oftentimes, the men that you hear about are the ones who don't get it right. And when we see firsthand and know firsthand, there are many men who get it right and who mentor other men. So our model is one of affirming, and our motto is one of evidence-based. So one of our mottos is the 24/7 dads. And then last but not least is the effective co-leadership with Reach Up Board of Directors and our foundation, of which we really couldn't move forward very far without that support. Next slide. So accomplishments, while I am grateful and thankful for numerous local, state, and national awards to me for the work over the past 22 years, I gotta say I'm most amazed by and most grateful for the love and support of my immediate family, big enmeshed immediate family, my work family, my church family, and my community at large. Together, we have accomplished so much, and it doesn't seem like 22 years, but we've accomplished a lot, and yet there's work still to be done. And so I wanted to share with you just a few of the accomplishments that has made an indelible mark in my heart and my psyche. And the first is we've been able to maintain no mission drift for 22 years and to realize my vision. The second is we reduced the gap in infant mortality rates in Black babies as compared to white babies by 57% in the service area. When we started on this journey in Hillsborough County, our Black babies were dying at a rate 4.4 times that of our white babies. Now it's 2 times more, which we have a ways to go, but there is vast improvement. And so I look forward to the day when that disparity is zero. And not only that disparity is zero, that there are no babies dying unnecessarily in childbirth and or shortly after birth. We have leveraged more than $6 million for service provision for our families here in Hillsborough County. I mentioned earlier, we've hired a multidisciplinary staff and team. And last but not least, I'm able to leave a legacy of a thriving, not-for-profit 501c3 organization that I know will continue to support optimal health for all. Last slide, please. So on behalf of some of our Nurse Family Partnership youth and kids in their graduation, I want to say thank you and blessings to all of you for your great work and the call on your life and your life trajectory. Blessings. Thank you.
Thank you so much, Lo, for that powerful presentation. And thank you so much for the important work that you're doing to bringing equality in healthcare. Loved what you said about rejecting fear, having a supportive team, being connected to your dream. Such important points. Thank you for your time.
Welcome.